In October 2021, the Canadian Drug Policy Coalition, in partnership with the John Howard Society, Indigenous Harm Reduction Network, and the Gilbert Centre, conducted a 2-day community dialogue. The discussion focused on the effects of drug criminalization policies on health, human rights, the toxic drug supply, and the ongoing drug poisoning crisis. The report was published in April this year, outlining 5 key recommendations. These are the creation of a municipal task force, exploring a potential request for the decriminalization of illicit drugs, enhancing immediate access to deeply affordable housing, offering harm reduction training for municipal staff and municipally funded social service agencies, and establishing collaborative multi-sectoral decision-making bodies that involve individuals with first-hand experience of substance use. We hosted a panel discussion involving representatives from the Canadian Drug Policy Coalition and the Gilbert Centre to delve deeper into the toxic drug crisis and the report's recommendations. This is the second and last part of the panel discussion. And that's one of the point came up during my interaction with whether it's homeless people or activists or organizations that the Salvation Army a food program closed down, and a lot of those echoes you can see in those in May 17 motion as well, that you can't distribute the food, you can't distribute the groceries. So it seems from their point of view is that city is trying to push those people out of the city, and one of the point was the family reunification fund, and Councillor Nigusi, the first black councillor of Barrie, he spoke that a lot of these people are not from Barrie, and they need to be reunited with their family. And Nigusi came to Canada as a refugee. I came to Canada as an immigrant. Even Mayor came to Canada as an immigrant. So if this is coming from the people who are not from Barrie, it's gives very different impression that then who is from Barrie and who is not. And then I mentioned in one of my interaction that other than Indigenous community, no one is actually from Barrie. So that's definitely point came up during my interaction. So this question is either from Denise or Beeta. In the report, the report takes not very, it's very balanced in terms of it's that police is not the solution, but it also says police is not the problem. So it's not blaming the police. At the same time, the report also praises that during the COVID, then the police took a step back and kind of helped homeless people, did not evacuate the camp. So how do you see the role of the police in dealing with this crisis of homelessness and decriminalization of drugs?
Something that came up in the report, as well as in our national decriminalization platform, is that in order to have a rights-based approach to drug policy, we really need to look at minimizing police interaction with people who use drugs. I think that the police are dealing with a number of issues that they are not trained to do. So for instance, providing complex mental health care or providing housing. There are people who are trained and who work in social work, who have the experience to engage with people and help them in a way that is less harmful than a police officer providing that service. I think that I think that police interactions with people who use drugs should be minimized. The fact that drugs are illegal, as in under current laws, means that a person who uses drugs is not going to feel comfortable with police, whether or not they are charging them in the moment, whether or not that police officer is a good officer or a bad officer. I think the police represents a system of criminalization and a potential threat of being charged, and therefore they're not the right people to be offering these very complex social supports for people. And there are people who are well trained to do so. And so when I think about it, it's like, let's put our resources towards what will work and to the person who can do the job in the right way, like the right tool for the job.
I think sometimes it's hard for, like, say for like community engagement to have like people who use drugs in the same room as police officers. So I think in that kind of aspect around like planning around, um, I don't know, like I just think having them not be in so many spaces is kind of helpful in order for us to really understand the needs of the people who use drugs. Another thing is, and like I agree with Beeta that um, they're, yeah, probably not. I mean, they're already probably overburdened, and adding this like dealing with like doing like mental health calls or wellness checks and that sort of thing when there's a potential for that person. I just think it'd be better suited if we had like a community response team to go out and get those calls. And if if it escalates or whatever, then that's when you get the police involved. I think it would probably really help police departments to kind of have that sort of aspect kind of taken away so they can deal with other pressing police issues like, I don't know, murders and other
More
crimes in
serious
the
crimes,
community.
yeah.
Not necessarily coming down on somebody who's like smoking their drugs, or you know what I mean, like
Yeah.
there's other things that they could be doing.
Yeah.
Police departments when it comes to specialized policing units, like whether that's crimes against persons, folks that deal with sexual violence, folks that deal with, or the police officers that deal with like crimes against children, those kind of things. Those programs are often really under-resourced as well, or those departments are often really under-resourced because there needs to be like if the police are constantly getting called out to these small minor things, then there's just simply not enough police officers and there's not enough resources to do the other things that are really truly impacting community in really negative ways. And I mean, we know through like historically, but also in the last few recent years with the McLean's Unfounded report, that there's a lot of issues when it comes to how criminal legal systems in Canada respond to sexual violence and those sorts of things. And I think that like structurally part of that is, again, a prioritization of what it is that we are putting our money and our resources into, especially if those are finite, and reprioritizing so that we're taking care of people who are being impacted by violence. And not necessarily equating drug use with some sort of terrible bad behavior when in reality the majority of drug use is not connected to those things, but we have this stigma or we have this narrative that exists that if you do drugs it automatically means you're going to do XYZ as well, and in most cases that's not the truth. So we really need to understand that reality, but then also prioritize where we're putting those limited resources. And I think even from the policing perspective, like that includes putting resources into making sure that police are trained in how to respond to those kinds of crimes, and have the resources to be able to do so meaningfully. And they can't do that if they are coming out every time there's someone who's experiencing homelessness downtown. Like they just simply cannot.
Yeah. Because when I was living in Arlington, Massachusetts, suburb of Boston, I did a 9-week long Citizens Police Academy, and so they teach how the police work is done, for the residents. And one of the things we did was we went to the training center, and they have these simulations where you go in and you pretend to, I don't know, a criminal comes to you on a big screen, and then you have to react in fractions of a second. And one of the things we did that he comes at you, and then before you have to predict what that person's action is going to be, and then you have to react. And in most of the cases that you don't know, like he has a gun or knife, and then we have to react, and then we try to shoot him, and then the police from the behind in the control room said you're already dead because he had a knife, and it's taken so many such fractions of seconds for that person to reach to you. And then at that time I didn't realize, but as I look back, then this is how police get trained, that you have to react in fractions of second, just anticipating that that person might have a gun or a knife. So the best course of action is just to shoot,
Which is scary.
because you never have a time, enough time to react. And that's how the police are. If the police are trained, and if they are going out to somebody is overdosing, or there's any other criminal act, then this is how they are going to react, because that's the mentality they go out in the field with. And if, as you said, there is a community group that is specially trained to address drug overdose, so they go out different approach. If the fire brigade go out, they have very different approach to put out the fire. They don't go out with the mentality of shooting the gun. And another experience, I almost living in Barrie for last 2 years, very close to downtown. 10-15 minutes I reach the downtown. I almost every night I go into the downtown, sometimes midnight, sometimes 1 p.m. and I go by the Beeta Center. I see people sitting outside. I see in downtown people, homeless people. Sometimes I see people, they can't walk because they have consumed drug. But not once, not a single time I had a bad experience. Like nobody called out, and nobody said anything, nobody threatened me. But opposite to that, many times I went out and there I see young people mostly, and in almost all cases white. They are in their car, but they yell out, they yell out in F you, what are you doing here, go back. And that experience I never ever had with homeless or people using drugs. So I saw that firsthand. And right after the May 17 motion, in May 14th or May 17th, May 14th I guess, I went out the same night, midnight, and I had my audio recording on, and I also posted this short video. And I in that video there's one woman, a white woman. She approached me for money. I gave her whatever money I had, and then she, on the same Dunlop Street there was a black man, and then they saw each other, and she said oh my God, brother. And then he said, oh sis, what are you doing here? So that's interaction. Even I was surprised to see that. So that's the interaction you see at midnight. So these people aren't going up to each other or yelling or making a scene. They are actually caring for each other. So she was so relieved when she saw him that there's somebody that she knows that she can go to, and who can protect her. So that was very surreal experience for for me as well. And as we are,
I had just found out one of my community members passed away, so I was pretty distraught. And whatever, so I went outside to have a smoke, and then I saw somebody like literally just reverse into my father's parked car on the street, and then they drove away. So anyways, I called the police. Like a dude in a tactical uniform came to my house for this traffic violation, and it was the most oddest thing to me, because he was in a full tactical uniform, 2 guns on his hip, a vest, the whole thing, and just his demeanor was very like, it was my fault that this happened, and I was burdening him with my call. And I think those kind of interactions with police kind of deter you from even calling them. Like, I don't like to call the police. I'd rather have a community group come respond and help me. Even like with people who are experiencing like mental health crisis on the streets. That's a very scary situation when police are called to deal with that. And I think there's got to be a better solution than like an officer coming out in a tactical outfit that's just like so intimidating. Like,
it's like a war zone. That's the attitude.
Yeah. So, anyways, I just want to add that.
No, thank you for that. And also in the report, it's, as you said, that deters people from calling for help, because there's this Good Samaritan Act,
Right.
that if somebody is overdosing, that if he calls police, uh, you are no you are not held liable, maybe if you are using the illegal drug, but that doesn't apply, I guess, when it comes to outstanding warrants.
Yeah.
So you can get arrested, and one of the uh, story in the report is that this person overdosed 3 minutes from the hospital and nobody called because everybody is scared.
Yeah.
So not only that the person will lose the life, but other people who are there, they might also get into trouble.
Well, and I think, like, in terms of the policing, like, I had this conversation earlier, actually, with a placement student here, is that, like, that policing isn't just the police as well. Like, that policing and that surveillance is built into so many different pieces. Like, we were having a conversation, even if somebody is protected under the Good Samaritan Act, they still might potentially have their, like, if they're on probation or parole, it could impact their criminal legal status and their freedom if use of drugs is one of their conditions. It could also impact their access to methadone or opioid agonist treatment if they are caught overdosing, because then if they've worked up, for folks who are unfamiliar with accessing methadone, there's pretty intrusive practices about having to urinate in a cup every day in order to be able to access the amount of medication that you need. And if you urinate and it comes back with drugs in it, then they can drop your medication down. But if you need that level of medication so that you're not going into withdrawal, then your only other option is to supplement with other drugs. And so if you're at risk of losing the drugs that you need to stay safe, so that you're not constantly having to access an unregulated and unsafe supply, then you're going to be really unlikely to call 911 in those cases, whether the direct police are going to come out or not. And depending on people's experiences, even the most well-intentioned police officer, if, like you said, they're afraid coming out, then their interaction with people could potentially be really negative and really hostile. And when people are in an emergency situation, that's felt a lot more deeply. And so those interactions can lead to really negative interactions overall if people are afraid and then they act out in that response. So even if they're protected under the Good Samaritan Act, they're not protected if a police officer sees them as resisting something that they're asking them to do, or if there's any other criminal things that are going on, or if they're viewed as trafficking, or if they're known to police as potentially supplying other people with drugs. Like all of those interactions, while they may be protected and the police may not go out to arrest them, they're still really negative and have really deep implications that impact people's lives and their overall safety.
So now, talking about the last 2 points of the report, is one is to hire people who had the lived experiences, and another is no more pilot projects. That really came across as this report is taking a stand that this is just you're trying to roll out, or trying to do something a little bit, and then you just abandon that. So starting with hiring people with lived experiences, and you come across a lot of those people, and how do you think they are equipped to work with the people who are facing the same issues?
Yeah, I mean, I think Beeta will be able to speak to this as well, probably more eloquently and with a lot more knowledge behind it, because there's a lot more experience outside of Barrie where that is happening and where it's working. But I think from the perspective of my work here at the Gilbert Centre is that people are creative and ingenious. Like when it comes to finding solutions to problems, the people that I work with who are experiencing some of the worst things society has to offer, they are extremely crafty in finding ways to get what they need, to do and support community in ways that are beneficial and in ways that are realistic in terms of meeting their comrades' needs. And so I think that is often something that's not considered when we look at what is valuable when it comes to like leadership and experience. And I think it's about I think the disconnect is providing people with a space and an opportunity to bring some of those pieces forward in conventional ways. And I think that is kind of an overall theme that like what we've been doing for a really long time is not working. That's very clear. And the people that are most impacted are going to have the best insight when it comes to what is needed and what is not working. And I think that part of that though is that oftentimes people that I work with are the most creative, but also the most kind of unorthodox. And so finding spaces and creating spaces where people can shine can be really difficult, especially in an office setting where it's like a 9 to 5 and you need to be able to write reports and you need to be able to sit down through a, hour-long meeting on Zoom and not get distracted. I mean, there's just a ton of people that doesn't work for. And so I think it's about really understanding that doesn't mean, like being able to do those things doesn't necessarily mean you're successful, and creating spaces where people can be successful and can shine and bring forward all of the amazing knowledge that they have. And it's, from an agency perspective, it can be really difficult to find resources, to find funding, to find a space for it. So I think we need to kind of revision what is productivity, and kind of go from there.
Yeah.
What do I think? In my experience, like I've worked at a community health center in Toronto who did have a CTS, who had a really strong harm reduction program that's like 25 years old, 26 or 27 years old now. And that was basically created by drug users. And very resourceful community and very like just really cool to be around. It's like what Sarah said about creating these spaces, like, and it is hard to have it inside like an office space. And I think it is important for us to keep creating those spaces, maybe outside of like office, like meeting up in the park or meeting up somewhere if we're allowed to, like, who knows, around Barrie, like if you can, there's not enough spaces for people to even go in and sit down, and you're getting kicked out of Tim Hortons. McDonald's doesn't have seating anymore downtown. You can't go to the bus station, or, you'll get your tickets if you're whatever, you get kicked out. So anyways, there's not a lot of spaces for people to like gather. And I think that it's part of like agencies in Barrie that are directly working with people who are unhoused or facing homelessness, to really create those spaces. But again, there's no money, there's no resources. Like AIDS service organizations, I don't think has had a top up in like 10 years or something like that, which is problematic when we're trying to fight like HIV transmission and all of that, and it just keeps going up. So this has to do with like federal funding, and this kind of leads into those pilot projects where it's just like, organizations, put together a grant for a project that's like short-term contract where you're supposed to be engaging with people who use drugs. Then you start that process, and then you have to apply for another grant. Then you got to wait for that money to come in. And then all these people are waiting for this program to start. And if you don't get funding for it, then there's nothing. And that can be heartbreaking to a community that's always seen as like unlovable, So we need like, there needs to be a refocus of where this funding comes from and where it's going into. And, people just don't care about people who use drugs. Like they just, they're seen as like very awful people, dehumanized, and we really need to get back to looking at people as human beings. It's just simple stuff like that, so.
And that's the actually name of the report, and I think that's all these 7 points. The focus is seeing them as humans and giving them housing and the space to grow and develop. So in terms of recommendation and how to implement, if you can, from your experiences with other communities or how it can be done in Barrie, but how do you see this recommendation can be implemented in Barrie?
Yeah, so to add on what Sarah and Denise were saying about meaningful consultation with people who use drugs, it's really important for those at the center of a policy and those with a direct experience about what works or what doesn't work to be involved in developing policy. So there are guidelines for paying people appropriately for their time. The Canadian Association of People Who Use Drugs, I believe that they recommend a minimum of $25 an hour. And like that's connected into actually seeing people who use drugs as humans with expertise, with knowledge, with resources to share, and really valuing that knowledge. And so something that the city can do, I mean, in light of such little funding for organizations that are really doing so much labor in this field on very minimal budgets, the city can offer funding for organizations to have regular meetings for people who use drugs in their community, to build their capacity in being able to advocate and being able to provide their insight in, you know, what are very bureaucratic processes. So I think there's room for the city to demonstrate that it cares about people who use drugs, that it's interested in developing policy that will work by funding space, food, and honoraria for people to gather on a regular basis and to work with those organizations that have those relationships with people who use drugs to offer that kind of programming. And I think that'll go really far in helping any city with addressing the crisis that we're facing.
Yeah. So do you have any add-on to that in terms of working with the city to implement these recommendations?
Well, I think too, like education is a big part. So not educating the people who use drugs, but actually educating the people at the city around like harm reduction and what that actually means, what a harm reduction actually looks like. I think it's a lot of like, yeah, just education. Like people will have to rethink how they see people who use drugs. So they're going to really have to look within themselves and to ask themselves their own questions. Why do I feel this way? Why do I feel afraid? Where is this fear coming from? Because those of us that work with people who use drugs, we're not afraid. I'm not afraid to go in a park. I'm not afraid to be in a parking lot. And I get approached all the time by people. Like, it's just, I don't know what it is, but people just like to come up to me. And yeah, I'm not afraid. So I think like to further kind of support our community members, we need to provide education to like city council or the Simcoe County around harm reduction first. Then we can kind of ease into these other conversations around decriminalization and what that's going to look like for our city, around safer supply and what that's going to look like for our city. I think what it seems to be is like they just want to eradicate drug use, which it's not gonna work. Like drugs are going to be around forever, and people are going to use them. So I think even that first step of acknowledging that we can't stop people from using drugs is a first step, and then really keeping them just like not in check, but they have to kind of keep themselves in check. Sorry, but I'm just like with last night with the rally, like I wanted to say, is this where you want to be when Jesus comes? Like, because everybody's so faith based and they're a Christian, but they're really not treating human beings the way that Jesus would. So I think it's just like a lot of education, and they, by the time one of their family members might be affected by an overdose, and they might, oftentimes you see that somebody in a family loses somebody to the drug toxicity, and then they want to get involved in harm reduction work. So instead of waiting for that to happen, why don't you get it started now? And let's start educating. Let's start having conversations, because it really has to do with the education piece and eradicating the stigma that's being associated. I'm sure some of them probably go home and have a few glasses of wine on a Friday night, Well, that's no different than somebody like wanting a toke or whatever, like it's a substance. Everybody uses drugs illegally or illegally. So, yeah.
Yeah. So, what in terms of recommendation as well as, do you have any plans to take this report and to the city council and explore what can be done?
I think that there will our organization has just received some funding, not a pilot project, but still way too short. But a pilot project. It's still a pilot project, but it's 5 years, and we're into the second year now. And we're working collaboratively with 4 other aid service organizations in Northern Ontario to create better pathways for HIV testing and treatment, as well as support, specifically among people who use drugs, because that is one of the highest priority populations in Ontario. So I'm sure that there will be a ton of things that come out of that. First and foremost, though, we really want to make sure that we're engaging with people who are actively using drugs. And so really putting our practice where our mouth is, and creating advisories where people are being paid as much as we possibly can with the budget that we have, to really bring forward their knowledge and their information, as well as what they want to see in the program. So I'm hopeful that will, part of this will be bringing forward the report as evidence of some of the stuff that is needed in the community, that we can bolster with the advisory committee. I think that there are other things that we need to do as well, in terms of those recommendations. We really need to understand where we're coming from when it comes to our drug policy, and that I think there is often, I think Denise spoke to it earlier, this shirking of responsibility between different levels, and absolutely every level of government, including our local Barrie City Council, as well as our Simcoe County municipal level, all have a responsibility when it comes to drug policy. We can't at this level determine what the criminal code says, but we can determine how we're impacting the lives of people who are most impacted by drug policy. And we can do other things at a local level to start increasing people's ability who are using drugs to become part of the decision-making process. And we need to be doing that as well. All of the levels of government need to be advocating at the levels above them, for what we need to be doing. Like the current, as you were saying earlier, this CTS, or the Supervised Consumption Site application, is still waiting. Our Barrie application is still waiting at the provincial level, and our municipal level, or our municipal government has the ability to advocate to the provincial level for the need within our community. So even though they can't necessarily determine whether or not we're going to be decriminalizing all drugs in Barrie, they can be having a direct impact on how people are treated in our city. And so those are some of the things that I hope that this report and this interview will help to motivate them to do, and things to get involved with, because those are things that we need to save lives right now, so that we can continue to do this work in years to come, because it's going to take a long time, but it's worthy, and I don't know that everyone feels that way yet.
Awesome. Sure. Thank you so much, Sarah, Denise, and Beeta, for joining me today. Thank you.
Thank you.
Thank you.